Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a urologist talking to a patient called Mr. Thompson. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mr. Thompson. How are you feeling today?
Morning, doctor. To be honest, I'm in quite a bit of pain. It's been like this for days now, sharp, stabbing pain in my side and lower back. I've never felt anything like it before. The pain comes in waves, and when it hits, it's unbearable.
I'm sorry to hear that, Mr. Thompson. It sounds like you're dealing with something very uncomfortable. Based on what you've described, it's possible you might have a kidney stone. Kidney stones are a common cause of severe flank pain that can radiate to the lower abdomen and groin. Have you noticed any other symptoms, like changes in your urine, nausea, or vomiting?
Yeah, actually. My urine's been darker than usual, and I've felt nauseous a few times. I've also noticed I need to go to the bathroom more often, but sometimes it feels like I'm not fully emptying my bladder. And when I do go, it burns a little. I was hoping it would pass on its own, but the pain is just too much.
Those symptoms are very typical of kidney stones. They form when minerals in your urine crystallize and clump together, creating hard deposits. Depending on the size of the stone, it can cause significant pain as it moves through your urinary tract. It sounds like your stone might be causing a blockage, which is why you're experiencing such intense discomfort.
That makes sense, but what causes these stones to form in the first place? I've heard about them before, but I never thought I'd end up with one.
Kidney stones can develop for several reasons. Dehydration is a common factor. When you don't drink enough water, your urine becomes more concentrated, making it easier for minerals to crystallize. Diet can also play a role, especially if you consume high levels of oxalates, calcium, or protein. Other factors include a family history of kidney stones, certain medical conditions, or medications that can increase the risk of stone formation. Do any of those sound familiar to you?
I guess I haven't been drinking as much water as I should, especially with my job. I work in construction, and it's easy to forget to stay hydrated when you're busy. And I've probably been eating more fast food and salty snacks than I should. I didn't realize that could lead to something like this.
It's easy to overlook hydration and diet, but they're crucial for preventing kidney stones. The good news is that there are several ways to treat kidney stones and prevent them from returning. The first step is determining the size and location of the stone. We can do that with an ultrasound or a CT scan, which will give us a clear picture of what we're dealing with. Depending on the size, we'll decide on the best course of action, whether that's letting the stone pass naturally, using medication to help it along, or in some cases, a procedure to remove it.
That sounds good, but I'm worried about the pain. It's already been hard to manage, and I don't know how much longer I can take it if the stone doesn't pass quickly.
I completely understand. Pain management is a priority, and there are several options we can consider. We can prescribe stronger pain relievers to help you cope while the stone is passing. Additionally, certain medications can help relax the muscles in your urinary tract, making it easier for the stone to pass. If the stone is too large or causing complications, we might need to discuss more direct treatments, like shockwave lithotripsy, which uses sound waves to break the stone into smaller pieces, or a ureteroscopy to remove it.
I'm open to whatever will get this over with as quickly as possible. I just want the pain to stop. How long does it usually take for a stone to pass on its own?
The time it takes for a stone to pass naturally can vary depending on its size and your body's response. Smaller stones, typically those under 5 millimeters, may pass on their own within a few days to a couple of weeks. Larger stones might take longer and are less likely to pass without medical intervention. That's why it's important to monitor your symptoms closely. If the pain becomes unbearable, or if you experience other issues like fever or inability to urinate, we need to take more immediate action.
Extract 2, questions 13 to 24. You hear a gastroenterologist talking to a patient called Laura. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Laura. So, I understand you were referred here because you're worried about food poisoning.
Yeah, I'm really not feeling well, and I think it might be something I ate. I've been sick for a few days now, and it's just not getting better.
I see. I'm sorry to hear that. Food poisoning can definitely be rough. Why don't you start by telling me when your symptoms began and what you've been experiencing?
It all started 3 days ago. I was out with some friends at a new restaurant. Everything was fine until later that night when I started feeling nauseous. Then I started vomiting, and it just hasn't stopped. I've been in and out of the bathroom, and it's been pretty bad with diarrhea too. I'm just exhausted.
That does sound concerning. When you first felt sick, how long was it after the meal you had with your friends?
Probably about 6 or 7 hours later, if I remember right. I felt fine at first, but then the nausea hit me like a wave, and since then, I haven't been able to keep anything down.
That timing fits with food poisoning. Symptoms typically begin within a few hours to a couple of days after eating contaminated food. Have any of your friends had similar symptoms after eating at that restaurant?
Actually, yeah. One of my friends texted me yesterday saying she was also feeling sick, similar symptoms, but I think mine are worse. We both had the same dish, some kind of seafood pasta. I'm really starting to think it was that.
Seafood is a common culprit for foodborne illnesses, especially if it wasn't stored or prepared correctly. It sounds like you may have been exposed to a bacterial infection like salmonella or even a virus such as norovirus, which can cause similar symptoms. But we'll need to run some tests to be sure.
Oh wow. I didn't realize it could be that serious. I thought it would just pass, but I've been feeling so terrible that I wasn't sure anymore.
You're right to be concerned, especially since it's been a few days and you're still feeling this bad. Have you had any fever, abdominal pain, or noticed any blood in your stool?
I haven't noticed any blood, thankfully, but I've had a low-grade fever, around 37.8 degrees Celsius. And yes, there's definitely pain, mostly in my lower stomach. It's not constant, but when it comes, it's like these sharp cramps that take my breath away.
That kind of pain is typical with food poisoning, particularly if your digestive system is inflamed. The good news is, most cases resolve on their own within a few days to a week, but if it's bacterial, we might need to consider antibiotics, especially if you're feeling this unwell.
I hope it's nothing too serious. I've been trying to drink water, but I feel like I'm getting dehydrated because I can't keep anything down, even liquids.
Dehydration is definitely something we'll need to watch for, especially with the vomiting and diarrhea. It's one of the main complications of food poisoning. Are you able to urinate normally, or has that changed too?
Actually, now that you mention it, I've barely been able to go. I guess that's another sign I'm dehydrated, right?
Yes, it is. Dehydration can sneak up quickly when you're losing fluids through vomiting and diarrhea. We'll probably want to get you on some intravenous fluids if it doesn't improve soon. Are you able to tolerate any food at all, like crackers or toast?
I tried some toast yesterday, but even that came back up. I've just stuck to small sips of water since then, but it's not enough. I feel so weak.
That's understandable. For now, focus on clear fluids like water, broth, or an electrolyte solution if you have it. We can talk more about reintroducing food once your stomach settles down. Let's also check for dehydration, and we can consider running some stool tests to figure out exactly what's causing this. If it's a bacterial infection like E. coli or Campylobacter, we'll want to treat it appropriately.
Do you think I'll need to go to the hospital for this? I'm starting to worry it's something more serious.
Right now, I think we can manage it without hospitalization, but if your symptoms get worse, if the pain intensifies, or if you start seeing blood in your stool, or you can't keep any fluids down at all, you should definitely go to the ER. Otherwise, we'll see how you respond to hydration and monitor your symptoms closely.
Okay, that makes sense. I'll keep an eye on it, but I really hope this goes away soon. I can't miss any more work.
I understand. Food poisoning can be really disruptive, but with the right care, most people start to feel better within a few days.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a patient talking to a receptionist. Now read the question.
Hi, I've been reading a lot about how bacteria in the mouth can affect overall health. Can I talk to the dentist about this at my next appointment?
Sure. Do you have any specific concerns?
Well, I'm just wondering if I might be at risk. I've been dealing with bleeding gums for a while, and I've read that it could be linked to heart problems.
That's definitely something to discuss with the dentist. Bleeding gums can sometimes indicate gum disease, which has been associated with other health issues.
Yeah, exactly. I'm worried it's a sign that something more serious is going on.
I understand your concern. We'll make sure the dentist can talk you through it. There's an appointment available tomorrow.
Great. I really want to get this checked out.
All right, you're booked for tomorrow at.
Now look at question 26. You hear a conversation between an obstetrician and midwife. Now read the question.
Delivery, which was stitched up. Is this her first postnatal checkup since the operation?
Yes, that's correct.
Okay, so today we're going to begin with pelvic floor rehabilitation exercises. This will help strengthen the muscles that weaken during the pregnancy and childbirth, especially following her C-section and the perineal tear. These exercises are crucial for preventing incontinence and improving overall recovery. We'll also check for any signs of infection or complications related to the stitches. Over time, with consistent work, she should regain her muscle tone and reduce any lingering discomfort. Recovery is key to helping her resume normal activities without long-term issues.
Now look at question 27. You hear a psychologist talking to a patient. Now read the question.
How have you been feeling lately, Sam?
A bit overwhelmed, honestly. I've been spending a lot of time on social media and it's starting to feel like it's affecting my mood.
That's understandable. Social media can have that effect, especially if you're constantly exposed to other people's highlight reels. Have you noticed specific negative impacts?
Yeah, I've been feeling more anxious, especially when I see friends posting about things I'm not a part of. But on the flip side, I've also found some great communities online that have really helped me feel less alone.
That's good. Social media definitely has its positives, like support groups or finding people with shared interests. The key is to find a balance. Have you thought about setting limits on your screen time?
I tried that before, but I didn't stick to it. Maybe I should give it another shot. I can see how too much scrolling is making me feel worse in the long run.
Absolutely. Taking breaks and being mindful of how much time you spend online can really help. If you feel worse after being on social media, your mind is telling you something.
That makes sense. I'll work on setting better limits this time.
Now look at question 28. You hear a biologist reporting on some research she's been conducting. Now read the question.
I specialize in studying circadian rhythms in animals and how these biological clocks affect behavior and survival. Circadian rhythms regulate everything from sleep-wake cycles to feeding patterns. I wanted to explore how these rhythms also influence the way animals use cryptic coloration, essentially, how they camouflage themselves to avoid predators. Many animals use coloration to blend into their surroundings, and I hypothesized that the timing of this behavior is regulated by their internal clocks. For example, animals might change their level of activity or adjust their color patterning to match their surroundings during specific times of the day. My research shows that some animals' camouflage becomes more effective at particular hours, enhancing their survival. Moving forward, I hope to study more species to determine the extent of this phenomenon.
Now look at question 29. You hear a trainee doctor discussing an alternative treatment approach with her supervisor. Now read the question.
Would you mind if we talked about Jason in room 3?
Sure. Is something wrong?
Not exactly, but I wanted to ask about the herbal medicine the family has been giving him. They're using a mixture they found online, and they believe it's helping reduce his asthma attacks. I didn't know what to say, so I just asked them to continue the prescribed treatment as well. I feel conflicted about recommending something without solid evidence, but didn't want to dismiss their concerns either.
That's understandable. It can be tricky when families turn to alternative treatments. How did the discussion go?
Honestly, I struggled. They seemed really convinced that the herbs were working, and it was difficult for me to remain neutral. I wasn't sure how to address their beliefs without sounding dismissive or critical. I felt like I didn't handle it well, and I'm worried I didn't come across as supportive.
Don't worry, these situations are always tough. You handled it well by encouraging them to follow the prescribed treatment. Balancing their beliefs with clinical advice is something you'll get better at with experience.
Now look at question 30. You hear a sleep specialist explaining a case. Now read the question.
Year-old man came in last night complaining about difficulty sleeping for the past 2 weeks. He reported waking up multiple times during the night and feeling tired throughout the day. He mentioned that he often checks his phone right before bed and tends to have irregular sleep times. He also mentioned drinking coffee in the evening to stay awake for work, and he sometimes naps during the day. When I asked about his bedroom environment, He said it was noisy due to traffic outside. He has no known medical conditions and has not tried any consistent sleep routine so far. I'm going to recommend creating a structured sleep hygiene routine to improve his sleep quality. This includes maintaining a regular sleep schedule, limiting screen time before bed, reducing caffeine intake, and making the bedroom environment more conducive to sleep by reducing noise. I'll also suggest a follow-up in a few weeks to evaluate his progress.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear a discussion with an infectious disease specialist, Dr. Linda Evans. You now have 90 seconds to read questions.
Today we're discussing a deeply concerning topic with infectious disease specialist Dr. Linda Evans, the Ebola virus. Dr. Evans, why does Ebola continue to be such a significant public health threat? And can you give us a brief history of the virus?
You're absolutely right. Ebola remains a very serious threat, particularly in regions where healthcare systems are fragile. The virus was first identified in 1976 near the Ebola River, in what is now the Democratic Republic of Congo. The outbreaks that followed were small and sporadic, but they were deadly, with fatality rates often exceeding 50%. What makes Ebola particularly dangerous is how rapidly it can spread once it enters a population, particularly through bodily fluids like blood, vomit, or even sweat. The 2014 to 2016 outbreak in West Africa was a turning point. It was the largest and most complex Ebola outbreak ever recorded, claiming more than 11,000 lives. This event exposed major gaps in public health responses and highlighted the urgent need for better diagnostics, treatments, and vaccines.
Can you tell us more about the difficulties in controlling Ebola outbreaks?
The main challenge with controlling Ebola is its highly infectious nature. The virus spreads rapidly, especially in communities where people are in close contact and infection control practices are inadequate. In addition, early symptoms such as fever, fatigue, and muscle pain resemble other common illnesses like malaria, making it difficult to identify early cases. By the time Ebola is confirmed, the virus may have already spread widely. Another critical issue is fear and mistrust. During the West African outbreak, many people were suspicious of healthcare workers, which led some to hide symptoms, refuse medical care, or even flee quarantine centers. This distrust significantly hindered containment efforts.
What are the initial symptoms and how does the virus progress?
Ebola starts with flu-like symptoms, such as fever, severe headache, and muscle pain. Within a few days, patients may experience vomiting, diarrhea, and abdominal pain. The virus then attacks multiple organs, leading to severe bleeding both internally and externally. This hemorrhagic phase is when patients are most contagious, and unfortunately, the chances of survival diminish greatly. The body's immune response is overwhelmed, and without timely medical intervention, such as rehydration and supportive care, the likelihood of death is extremely high.
How have treatment and prevention strategies evolved over time?
In the early years, there were no specific treatments or vaccines available, and the main strategy was supportive care, which included fluids and electrolytes. It wasn't until the 2014 outbreak that significant advances were made. Experimental treatments like ZMapp, a cocktail of monoclonal antibodies, and antiviral drugs showed promise, but their availability was limited. Vaccination has been the real game changer. The development and approval of the RSV-Zebov vaccine has significantly improved the ability to control outbreaks. The vaccine has proven to be highly effective when administered quickly, creating a protective ring around new cases. However, logistical challenges in delivering these vaccines to remote or conflict-affected areas remain a serious issue.
What's the current status of Ebola control, and are we better prepared today?
We're certainly in a much better position now compared to a decade ago, but challenges remain. Outbreaks still occur, mostly in Central and West Africa, and they can spiral quickly if not immediately contained. Rapid response teams, improved diagnostic tools, and the availability of vaccines have made a difference. But the real issue is ensuring these resources reach the right places at the right time. There's also the constant threat of the virus re-emerging, possibly even in urban settings where the impact could be catastrophic. Continuous surveillance and international cooperation are crucial for early detection and swift containment of any new cases.
What do you think are the next steps in the fight against Ebola?
The key lies in maintaining and expanding our surveillance and response capabilities. More research is needed into therapeutic options to improve survival rates, and efforts must focus on developing treatments that are easier to administer, especially in resource-limited settings. Education and community engagement are just as critical. We need to build trust with affected communities to ensure compliance with prevention measures. Moreover, investments in strengthening local healthcare infrastructure will help not only in managing Ebola, but also in controlling other infectious diseases that pose similar threats.
Extract 2. Questions 37 to 42. You hear a pain management specialist talking about the role of the mind-body connection in managing chronic pain. Now, read the questions. You now have 90 seconds to read questions.
Hello everyone, my name is Dr. Andre Collins, and I'm a pain management specialist.
Today, I want to talk to you about a topic that I find fascinating and that has been increasingly gaining attention in the medical community: the role of the mind-body connection in managing chronic pain. At our clinic in Birmingham, we have been exploring new ways to help our patients manage their pain by incorporating mind-body techniques into traditional treatments. Many of these patients have tried various pain medications for years, but still experience significant pain and frustration. That's where techniques like mindfulness, cognitive behavioral therapy, and yoga come in. Chronic pain is a complicated condition that doesn't just affect the body, it can also impact a person's mental well-being. Patients with chronic pain often develop anxiety, depression, or stress due to the persistent discomfort. This is why addressing both the mind and the body can be key to managing pain more effectively. Research has shown that these mind-body practices can help lower stress, increase feelings of control, and reduce the intensity of pain experienced. Mindfulness, for example, helps patients become more aware of their thoughts and bodily sensations without being overwhelmed by them. One of my patients, Sandra, had been dealing with lower back pain for over 10 years. She had tried numerous medications, physical therapy, and even considered surgery at one point. But nothing seemed to provide lasting relief. That's when we suggested mindfulness meditation. Initially, Sandra was quite skeptical. She couldn't imagine how simply focusing on her breathing or sitting quietly could help her in any way. But after attending a few guided sessions at our clinic, she began to notice subtle changes. She felt less overwhelmed by her pain, and although the pain didn't disappear completely, it became more manageable for her on a day-to-day basis. Cognitive behavioral therapy, or CBT, is another tool we use. It's a psychological treatment that focuses on changing unhelpful thoughts and behaviors, which can be particularly useful for people dealing with chronic pain. Patients with ongoing pain often develop negative thinking patterns like, "This pain will never go away," or "I can't do anything because of my pain." These thoughts can make the pain worse. CBT helps patients reframe these thoughts into more constructive ones, such as, "I may have pain, but I can still enjoy many aspects of my life." I remember another patient, John, who struggled with arthritis. He had become very withdrawn and often felt hopeless about his condition. Through CBT sessions, he was able to recognize how his negative thoughts were limiting him. He gradually began making small changes, like going for short walks again, which helped improve his overall outlook on life. Yoga is also an important part of our approach to pain management. Yoga combines movement, stretching, and focused breathing, which can help patients reduce muscle tension, improve flexibility, and enhance relaxation. Unlike other forms of exercise, yoga is gentle, and it allows patients to move at their own pace. It also has a calming effect on the nervous system, which can reduce the perception of pain. In our clinic, we've had a number of patients join yoga classes specifically designed for those with chronic pain. And many of them have reported an improvement not only in their physical symptoms, but also in their mood and overall sense of well-being. The ultimate goal of using these mind-body techniques is not to replace traditional medical treatments, but to complement them. For many patients, pain medication is still an important part of their treatment plan. However, relying solely on medication can lead to issues such as dependency and unwanted side effects. By integrating mindfulness, CBT, and yoga into their routines, patients can often reduce their reliance on pain medications and feel more in control of their pain. Managing chronic pain is a journey, and each patient is unique, which means that what works for one person may not work for another. The key is to offer a variety of tools and allow patients to find what helps them the most. The mind-body connection is a powerful resource that has been underutilized for too long. If we can help our patients find more comfort and a better quality of life by addressing both their physical and mental well-being, then I believe we are on the right track.
That is the end of Part C. You now have 2 minutes to check your answers.